So thinking about the patient perspective, those were two very vulnerable populations. Ben, why don't you provide another example from the patient-centered research activities that you have with creaky joints?
Yeah, there we go. All right. So good afternoon. My name is Ben Nowell. I'm the Director of Patient-Centered Research at the Global Healthy Living Foundation. And we have a large arthritis patient community online called Creaky Joints. Creaky Joints is probably the most recognizable, I guess, brand name of our organization. And we're an organization with a mission to improve access to care for people living with chronic conditions. And so we provide education, support, we do advocacy at the state and national level. And then most recently, within the past 5 years, we've developed a research infrastructure thanks to PCORI, and we're also a member of PCORNet, which I'll talk more about in a minute. But a couple disclaimers. One is I am also a first-timer at this particular workshop series, so this is the first one I'm part of. And this is a patient or patient participant perspective, of kind of one person sharing what I've learned from my experience in my organization and with some of the studies that we've worked on in developing our research infrastructure. But technically, I'm a patient like all of us in this room, right? We play those dual roles. And I guess probably the biggest disclaimer of all is that I probably didn't totally understand the session objective, because when I was sitting in the back talking to, it's like, oh, Peter Stein, I think you and I are in the same session maybe. Your name sounds familiar. So as he started to talk about the session, I was like, yeah, no, I don't think I'm in that one. But yeah, indeed I am. So this presentation may be a little bit adjacent to the topic. Yes, thank you. So in some ways, our, let's see, how do I advance? Press the big green arrow. Just the big green arrow. Oh, the big one. Okay, thank you. So I think the biggest message I have here is that, continuing the kind of food gumbo metaphor, is engagement is everything with patient communities and with patient-powered, patient-centered research. So the big message is invite us to the banquet, right? Invite us to this conversation. Invite us to dinner, to sit down and have these conversations. So instead of thinking of engagement as being something that is sort of a separate, part of the grant application or the study design, it is everything. It happens throughout the process. It happens in the selection of the data and the study design and the dissemination of results and who you partner with. So just briefly about where I'm coming from. So ArthritisPower, or some people know it as the AR-Power Patient-Powered Research Network. It's now a research registry of more than 16,000 activated patient participants with rheumatic and musculoskeletal disease. It was created in 2015 with support from PCORI. So we're one of the 20 patient-powered research networks, or PPRNs, along with the CDRNs, or clinical data research networks, that currently make up PCORNet. So within our network, we have the capacity to designate specific study cohorts, to create customized user flows. So a participant in a particular study on their smartphone or in a digital capacity would be able to experience something that is particular to their involvement in a particular study. As I think Kamathi Stem mentioned earlier from Monarch Biotech Bionetworks, the point of care is really shifting from the clinic to the smartphone, right? We get a lot of information there. We get messages from our doctors there. We can track our symptoms there, and so on. So our network really was intended to capitalize on that novel technology to engage patients in research. So ArthritisPower is both the name of the network and also the name of the smartphone app for mobile collection of patient data. So because, as I mentioned, engagement is everything, we have never been comfortable or content to just think of research as something where patients are just giving data away or reporting data, but we wanted to make it available to them so they could see how they're doing over time and track their own data. So there's many features of the network and the app in particular where they can track symptoms, they can look at the analytics over time, they can connect to other people, they can learn about research opportunities and so on. So it looks something like this where people enter data. Then in that third screen, they see a line graph of how that particular symptom or PRO changes over time. They enter medication data. The underlying ontology we use is RxNorm, so it's very comprehensive. This was developed and changed based on patient engagement, patient feedback. Initially, we just had biologics and DMARDs, things that patients were on specifically for the rheumatic disease. But they said, no, we want to track everything. So we added the capacity to really enter any medication they could possibly be on. They can overlay that information with their PRO data as well. So I show you that just to kind of frame the context of what we do and what we've learned in building our network, building this patient-powered research network. And again, I think engagement is something that's important throughout the process. So from the patient participant perspective, we're operating from this assumption that the important thing about research is that it enables patients to make a decision about their health care, right, in the future, now or in the future. So the fundamental question is, what information do patients actually need to make a decision, right? Because research generates information or generates evidence that then is good evidence, good information that people can then use to make a healthcare decision. Other fundamental questions are, of course, the other people have talked about more eloquently than I can, is that which data, which study design will permit us to actually answer the research question, what will allow us to actually get that information. An important question, again, this is fundamental to engagement, is what are the appropriate partners to work with, right? We know that it's not just, I think as other people have mentioned today, it's not just about data ownership, it's about access to data. Who are you working with? How can you link those data? And thinking about what partners do you want to work with, I think it concerns things like shared values. Are you going to work with a partner that cares as much about patient engagement and the patient perspective as we do, about the access to data? Obviously, you're deliberately selecting certain partners in a study based on the type of data they may have access to. And then it's an iterative process, so it's always about rethinking, okay, so given that we want to always keep our partners, our patient participants engaged, revisiting the data that we need and the study design that's best going to get us to the information, and maybe revisit that or reconsider that given our engagement priorities as well. So that's considering things like the participant experience, the user flow within a study, the consent. Are we being as transparent? Is there additional consent that we need to enact? What are the incentives for the trial, and so on? The other disclaimer, actually, I forgot to mention, is that we are not, as an infrastructure, as a group, my organization is not currently really a producer of evidence for regulatory purposes. We've worked with some industry partners. We work with academic medicine institutions all the time. And so we've provided information to, in the course of studies to better understand the experiences of patients on treatments, their perspectives about treatments, their unmet needs, what are their priorities. One of the studies we did on our own, really, was to find out what do patients prioritize, and we got a list of sort of education or knowledge priorities, information priorities they had, and the top two had to do with understanding the medications, how different medications work, how quickly they work, when to know a medication is not working, and so on. So for our population, which is largely composed of people living with rheumatoid arthritis, questions about the effectiveness of medication are extremely important. So I'm going to talk just to give, I think Greg Simon started the day by saying we want to use the specific cases to illuminate the general. So I'm going to talk briefly about a study that's in progress right now. We're actually just about to launch it within our network. It's a PCORnet demonstration project. So I think the official title is something like Harnessing PCORnet to Compare the Effectiveness of Biologic Therapies. We renamed it something a little more friendly to call the CHOICE study, so the Comparative Health Outcomes in Immune-Mediated Diseases Collaborative Study. The PI is Jeff Curtis at UAB. And it involves multiple networks, so several patient-powered research networks like ours, so adult and pediatric rheumatology or arthritis, adult and pediatric IBD, and also vasculitis. And then it also involves some of the clinical data research networks. So the aims of the study are to evaluate the comparative risks for infection, heart attack, and stroke, so it's understanding safety, comparative safety. And then importantly for patient community is to really understand the comparative clinical effectiveness of various medications using patient-reported outcomes. So going back to those questions on that prior slide, in terms of thinking about the engagement from a patient perspective, patients and doctors want to know what treatment works best, for whom and under what circumstances. So that's the key thing that we're operating from. So they need to make challenging decisions. They don't know how well the medications work or how quickly. What data do we need? We need to know condition, physician name, or treatment in order to identify what the diagnosis is, what their treatment is. Maybe we need additional screening questions. If all of our data are self-reported by patients, maybe we need to link to other types of data. We need to also know about the patient experience to identify the effectiveness. We need this velocity of data. We need certain levels. Certain time points. And then when we think about the partner, we also need to think about the patient, right? So we need to engage patients in a messaging that's going to make sense for them, let them know why it's important for them, how they can provide the data that they're going to give is something that only they can provide, and what's helpful and why, and so on. So this is my last slide. Just some other considerations about this and things that we've encountered in working with our patient partners and other patient networks on this is harmonizing data collection with other partners, the additional data required for validation, the adjustments we needed to make to our informed consent, incentives, how we have patients visualize their own data, can make comparisons with others who are like them. And dissemination, integration with clinical care, and so on. So with that, I'll finish by just saying that, first of all, thank you, and that I think for us, treatment quality is in some ways already predetermined because this is so patient-reported, and we're not wedded to specific clinical sites. It's really a virtual network, so I can talk more about that. Thank you.